Hello everyone, I'm Kritika Deshmukh. So as a part of Teach 1 from HAP 823, I'm going to explain the question number 3 from lasso regression. So lasso is nothing but least absolute shrinkage and selection operator. It's a type of linear regression which includes a penalty term to shrink the coefficients of less important variables to zero. And this helps in selecting a simpler model that avoids the overfitting and improves the interpretability by reducing the number of predictor. And the purpose of lasso regression is to select the minimum set of variables that would explain most of the variance in the response variable. So here the question number 3 has 4 sub questions. So first sub questions is we need to find the 5 most important features which increase the symptom remission for the patients who are taking 15 different antidepressants. So, and also we need to ask the chat GPT if a person with these features should take bupropion and report the difference between the regression and the advice of the chat GPT. So here in the first step, we are importing the logistic regression and also importing the train test split, which splits the data into training and testing. And from sklearn.metrics, we are importing the mean squared error to calculate the mean square error. We are also importing the pandas and numpy. So in the first step, we are loading the data here. Here you can see the data, which consists of the columns anti-dep, which has the informations on all of the antidepressants, var ID, C type, code, and the coefficients and the descriptions of the codes. So here in this DF bupropion, it filters the data to include only rows where the anti-dep column is bupropion. And here in this step, it resets the index of the data frame. And in the this line of code, here it drops the old index column. And in the 21st line, it filters the data to include only rows where the C type is ICD-9. So you can see the data which has the anti-dep column which contains only bupropion, and this C-type code you can see we have only ICD-9 codes and their descriptions. So in the question A, we need to find the top 5 important features. So here we are sorting the data frame in descending order based on the coefficient column. So it displays the top 5 rows. You can see the coefficients and the descriptions. So the top 5 features with the highest coefficients and that are considered the most important in terms of increasing symptom remission are non-dependent tobacco use disorder, abnormal weight gain, attention deficit disorder of childhood with hyperactivity, attention deficit disorder of childhood without mention of the hyperactivity, other problems related to lifestyle. So the response from the chat GPT was that the decision to prescribe the bupropion is a complex medical judgment that should be made by qualified healthcare providers. It should not be based solely on statistical analysis. These regression models can show the relationship between the certain conditions and the treatment outcomes, but they don't capture the full picture needed for individual patient care. So, this regression coefficients alone are insufficient for medical decision making. So, prescribing the medication involves considering the numerous factors like including overall health, potential adverse effects, interactions, and the patient's medical history. So, the key distinction between the regression analysis and the healthcare professional advice is that the healthcare professional has an ability to take a comprehensive view of patient situation. These statistical models are limited to the data they are built on and can't account for the nuanced aspects of the individual cases that a doctor would consider. So, the sub question B, we need to find the 5 least important features that can be used to rule out the use of the bupropion. So here we are sorting the data in ascending order. So these are the five least important features, like obsessive compulsive disorder, Alzheimer's disease, other convulsions, etc. So in the sub question C, in comparing bupropion and citalopram, what are the features that affects both the medications? If the first three digits of the International Classification of Disease codes are the same, consider them the same feature. So here we are including the rows where the C type is ICD-9, and in this new data frame, that is data buprosita, we are um, including the rows where anti-dep is either citalopram or bupropion. Here in this line of code, it adds a new column, that is ICD code, by converting the code column to a string and taking the first three characters. And we are grouping the data by ICD code. And here we are converting the grouped data into a new data frame, that is common ICD. And here we are filtering the data, that is the data buprosita, to include the rows where ICD code is 300. Here you can see we are having the antidepressants bupropion and citalopram, and the codes, ICD codes, and the here you can observe that these codes start from 300 and their descriptions. So suppose if we want to ask about the features listed in the two regressions, in what order the question should be asked? If we want to differentiate among the two medications with least amount of the queries, we need to list the 10 questions that are most likely to resolve the need to take one of the two medications. So these are the 10 questions that needed to be asked. They are the primary symptoms being treated. Are there any known allergies? Is there any history of seizures? Is there any history of suicidal thoughts? What is the average dosage of each medication? Is there any difference in the mode of delivery of the drug? What is the cost of each medication? And what is the success rate of each medication in the symptom remission? And are there any known drug interactions? Or what is the availability of each medication? So these are the 10 questions in the sub question D. So thank you.